All right, let's jump right in. Picture a high-stakes detective story playing out inside the human body. The detectives? They're doctors, and they're on the hunt for a silent but incredibly dangerous culprit that's a major cause of strokes. Their whole mission is to track down a blockage in a critical artery before it's too late. So today, we're going to open up the high-tech toolkit they use to crack the case.
So, why all the urgency? Well, it all comes down to this number. Get this. About 10% of all strokes are caused by a blockage in one very specific place, the carotid artery. That's a huge piece of the puzzle, and finding it is absolutely key to prevention. And this culprit, it has a name: carotid artery stenosis. The easiest way to think about it is this. Your carotid arteries are like the main highways for blood flowing up to your brain. Stenosis is what happens when those highways get clogged up by a buildup of gunk, fatty plaque, creating a really dangerous traffic jam. And that traffic jam, well, that's the real problem, isn't it? If the blood flow gets choked off, or worse, if a little piece of that plaque breaks free and shoots up to the brain, it can trigger a life-threatening stroke. So you can see why finding and measuring that blockage, diagnosing it with pinpoint precision, is so incredibly important. So how in the world do doctors actually peer inside these tiny, vital highways? Well, they've got this incredible imaging toolkit. Let's start with the first tool they almost always reach for, the one that gives them their very first peek at the scene. That first look, it almost always comes from an ultrasound. It's the go-to screening because it's non-invasive, it's quick, and it's actually fantastic for getting a feel for the plaque's personality. Like, is it unstable? Does it look like it might break apart? But there's a catch. The quality of the clues you get really depends on the skill of the person running the machine. And this is basically what they're looking at. On the left, you can see the artery wall itself, and on the right, all that color shows the blood as it's flowing through. From just this one picture, a really well-trained eye can spot trouble, like an ulcer or a weak spot in the plaque that signals a higher risk. Okay, so to get an even more detailed picture, doctors might call in an MRI or an MRA. Think of it like this. The MRI gives you this super high-resolution photo of the plaque itself, while the MRA creates a dynamic map of the blood flowing around it. And what's really amazing is that a lot of the time, they can get these incredible images without even needing to inject any contrast dyes. And wow, check this out. This shows you exactly what an MRA can do. See how the blood vessels just pop with clarity? It lets doctors zoom right in and pinpoint the exact location of the narrowing. You can see it right there, right where that arrow is pointing.
But what if you need answers, and you need them fast? Well, that's where CTA, or computed tomography angiography, comes into play. Its superpower is speed. It captures images incredibly quickly, and it's amazing at building a 3D picture of tricky, winding arteries that might be hard to see otherwise. Of course, there are trade-offs. The patient is exposed to some radiation, and it does require a contrast agent.
Now, all these tools are incredibly powerful, but sometimes a case just demands the most definitive, the most accurate, the most undeniable piece of evidence you can get. It's time to bring in the gold standard.
So, what is this ultimate test? What's the one tool that provides that final, unquestionable answer on just how bad a blockage really is?
It's called digital subtraction angiography, or DSA, and the concept behind it is pure genius. It's kind of like a cool photo editing trick. You take a picture of a room, then you take another picture with someone standing in it, and you digitally erase the room. All you're left with is a perfectly clear image of the person, or in this case, just the blood vessels. The process itself is so elegant. First, they take a baseline X-ray. Then they inject a contrast dye that lights up all the arteries, and they snap a second X-ray. Finally, a computer literally subtracts that first image from the second one. And poof, all the distracting background, like bone and tissue, just vanishes. And the result is what you're seeing here. I mean, look at that. This is the payoff. The clarity is just stunning. There's absolutely zero question about where that artery is getting dangerously narrow. This is the definitive clue that the detectives, the doctors, have been looking for all along. And this incredible detail is exactly why DSA is the gold standard. It's got the highest accuracy, period. It can tell the crucial difference between a vessel that's 99% blocked and one that's 100% blocked, which is a huge deal. It's the best way to find tandem lesions where you have multiple blockages. And get this, it can even predict certain surgical complications with 100% specificity. It just gives you information no other test can touch. Okay, so getting that perfect picture, that's really only half the battle. because an image is just an image. The next critical step is to turn that visual evidence into a hard number, a number that's going to guide everything that comes next.
And they use that number to classify the blockage into one of 3 distinct levels. As you can see, the first degree is considered mild. That's when the artery is less than 50% blocked. Second degree is moderate, which is anywhere in that 51 to 69% range. And third degree is severe. That's a blockage of 70% all the way up to 99%.
Now, this isn't just some estimate. Doctors use a standardized formula called the NASCET method to calculate that percentage. And this is so important because it makes sure that everyone is speaking the same language. It means a 75% blockage in one hospital is measured the exact same way as one in another hospital anywhere in the world. Okay, so let's tie this all together. This entire high-tech investigation, from that very first ultrasound all the way to that final calculation, it all leads to a crucial crossroads for the patient and their doctor. And this is really the crucial point of the whole thing. That final number dictates the path forward. For a blockage that's mild to moderate, the path is usually medical management. Medication, diet, exercise. But for severe stenosis, once you cross that 70% threshold, the conversation totally shifts to more invasive surgical options to physically clear out that highway. And that's why all of this matters so much. The difference between a 69% blockage and a 70% blockage can literally be the difference between taking pills and having major surgery. Every single step in this diagnostic journey is designed to get the most accurate information possible, all to make sure a patient gets put on the exact right path to prevent a stroke. We've seen just how incredibly sophisticated our tools have become for finding the problem. It really makes you wonder, right? With diagnostic tools that can see things this clearly, what's the next great leap going to be? What's the next frontier in not just finding strokes, but in preventing them before they even have a chance to happen?